Hey everyone, I'm Sarah Lavonne and welcome back. So I hear a lot of pregnant people ask the questions about what I can or I can't do when I'm in labor in the hospital. And then I also get a good amount of comments that the nurse or the doctor didn't let me do this or that when I was in labor. And so today, I really want to clarify some things to help you understand how to work with your care team so that you can have options while you're in labor, because those choices and that control is so important. But before I get started, be sure to like, comment, and then subscribe to my channel, and then let's get going. I think there's a lot of stereotypes when we think about delivering in the hospital with what you can and can't do. Even that vocabulary to me is actually like very interesting vocabulary that's used when patients or pregnant people talk about being and delivering in the hospital. So I want to talk about what your rights are as a patient. And to me, this information might be the most valuable tool and valuable information that I can give you as you anticipate, first of all, having a baby and delivering in the hospital, but also this applies to future care. This applies to your parents that might end up in the hospital sometime, or anytime like you go to your pediatrician's office. All of this is related to our patient's Bill of Rights. And so I'm gonna link that down below so you can actually check out the documents that literally tell you what your rights are as a patient, because newsflash, you actually have rights as a patient, which to me seems really silly that I have to say this, but unfortunately, especially with the work that we're doing with bundle birth nurses and training labor and delivery nurses, we see some of these cultural things that exist in the medical system, and especially I'm here to talk about labor and delivery and postpartum work, that there's these vocabulary used like, we're not gonna let you get off the monitor, or patients asking the nurse, like, can I go to the bathroom? And when, like in life, like I'm not gonna go and be like, hey, so-and-so, can I go to the bathroom? You're like, no, I'm gonna go to the bathroom because I have to go to the bathroom. And so there's that shift. The moment you become a patient, first of all, sometimes it can feel kind of like there's this hierarchy, there's this like doctor looking down on the patient or nurse looking down on the patient that really shouldn't exist. All of the talk in the hospital, we say these things like patient-centered care. The idea being that you as the patient, and you're not sick, but you are a patient because you're delivering in the hospital, and so you get your little like patient band and stuff. But with you at the center of the care, really it is that you are the first line of treatment, that your rights, your preferences, your thoughts, your concerns are most important, and everybody should be around you, your doctor, your nurse, your midwife, your charge nurse, your techs, your EVS, your cleaning people, like everybody's there to support you to have your baby safely and ideally have the best birth memory possible. And so first of all, I want to say that you have rights. And today I'm going to talk about what your rights are. I'm going to highlight some of the most important ones. So as you anticipate going into the hospital and having your baby, you know that there are things you can ask for. You know that you can walk in expecting respectful care, that that's within the realm of the norm, which I feel like it's so crazy to me that I have to say this, but we know, and if you're a patient, you can tell us down below if you haven't felt like you receive respectful care, that at times people don't feel respected in their choices, or they don't feel like they receive respect from their providers or whatever. And again, this is sort of the work of bundle birth nurses. We want to help make that change. And part of that change is going to come from you having the expectation, knowing and feeling confident that your right is to respectful care. And so in a moment in the hospital, if you ever feel like you're not receiving respectful care, first of all, my recommendation would be to just say so. And I know that might be hard. Not everybody likes conflict, but say your nurse says or does something that maybe doesn't feel respectful. To say gently and say, you know, my understanding is that one of my rights as a patient is to have respectful care. And I feel like, fill in the blank, when this happened, it didn't feel very respectful to me. So help me understand how we can move forward in helping me receive the most respectful, dignified care possible. Now, mind you, I scripted that out like off the top of my head, so that's not always easy, but if you kind of have the idea in your mind, you have the right to respectful care. Now, along with that, when we talk about Patient's Bill of Rights and the terminologies of letting you do things, you have autonomy over your body. And that includes that you have the right to make decisions for yourself. Now, mind you, and you've heard me say this in other formats, but this deserves its own standalone video because it's so incredibly important. So hear me out, okay? Your body is your body. Your labor and your birth is your labor and your birth, okay? And so all decisions should be made by you. Now, here's where this can get kind of muddy, is that all of those decisions should be made by you, but we don't want you making fearful decisions. We want you making informed decisions. And how do you make informed decisions? By talking to your care team. And this is where we have to sort of see your doctor, your midwife, your nurses as this amazing resource that you have at your fingertips when you're in the hospital. They have seen and done this so many times over and over again, and they're pulling from this pool and this wealth of information. They've studied this stuff for years. They're a resource and a help to you. They're not there to make the decisions for you. They're there to help advise you and look at your life, look at your situation, look at maybe any complications that they see and say, look, this is what I'm seeing. This is what I'm concerned about. Here are your options. Here's the risks, here's the benefits, and here are your other options. That information you are entitled to, okay? So if you ever are faced with a moment in the hospital or a moment with your providers where you're like, I don't understand at all what's going on, pause for a second. Obviously in an emergency, that's different, but in general, you're gonna have time for this stuff and say, so talk to me, doctor, about what are the risks, what are the benefits, and then what are my other options? And then it should be this discussion with you and your care provider where you can digest the information. First of all, it's easy to understand for you. And then you go, look, what are my preferences? What's important to me? What do I really want from this birth? What's most important? And how do I flex and flow? This is also why that's like, I say that all the time, because it plays into this, that like, how do I flex and flow to make these decisions that feel comfortable to me and also comfortable to my provider? Because your provider is there to care for you. They're there to make sure that you're safe. And a lot of times people hear things in the community or in the birth world, or they read something that really sticks that maybe doesn't apply to them or maybe might result in an outcome that you don't want, meaning like a complication, right? And so your doctor's there to help you navigate the flex and flow, helping you get that information, you digest it, you figure out your preferences, and then you come to an agreement. And then you both feel comfortable moving forward, knowing that it's gonna be safe for you and baby, and also hopefully help you with that birth memory piece. Okay? So I know this is kind of like this like elusive thing that goes around in circles, but I hope it's starting to make sense to you. The other side of that is that if something doesn't feel comfortable and you've been given the risks, the benefits, and the alternatives by your doctor, you have the right to refuse. If it doesn't feel good, if it doesn't work for you, if you understand all that information, you're a grown person, right? Or they say, nope, you can't get up to the bathroom and you don't have an epidural, because if you have an epidural, like you'll probably fall over. We don't want that. That's a safety concern. But like, let's say they're just like, nope, it's not our hospital policy for you to go to the bathroom. And you hear the risks, benefits, and alternatives. And all of a sudden you're like, you know what? I understand. And I'm taking responsibility for that risk, knowing that you've educated me, and I'm gonna walk myself to the bathroom and I'm gonna use the toilet because you're not in jail, okay? You have autonomy over your body. You have the right to make those decisions without coercion. And coercion is threats, it's threatening violence, it's forcing things, it's doing things without your consent. And so I wanna make sure you know this, because I don't wanna be naive to say this stuff doesn't happen, but occasionally it does. And I'm sure you've maybe heard stories, and the hospital doesn't always have the best rap. But I will say that one of my dreams is that we can learn to work together and build a bridge so that you can have those safe, positive hospital birth experiences. So your autonomy over your body, right to make decisions, but wise ones that are informed, ones understanding and treating you like the adult that you are, that's about to be this parent making decisions for your life. But then your side of things is that if you make a decision, especially in refusing care, that you understand what the outcomes could be, and you take responsibility for that decision rather than saying, well, no one told me. If they told you, then that becomes your decision. Does that make sense? So how would a conversation like this go? Let's say Your doctor comes in the room and says, hey, I really want to break your water. And you're like, wait a second, I know nothing about that. Now, mind you, hopefully you do because you've taken my childbirth classes and you're like, oh, hold on, I know all about this. Let's talk about it. Okay, it's always a conversation. Even if the vocabulary that's used is, let's break your water, I'm going to check you, do a vaginal exam, etc. All of that is not a no decision. This is a non-negotiable. Everything is your choice. And really, from a healthcare perspective, we should be asking you for permission to do anything to your body, okay? So doctor comes in, let's break your water, and you're like, oh, I know all about that because I took Sarah's childbirth class and I feel so much more confident after taking it. And then you're like, okay, so talk to me about why you would like to break my water. And doctor says, I am seeing that your contractions have kind of slowed down. I'd prefer not to start some Pitocin. It's been XYZ amount of time. I think this will help you deliver faster. Okay, so what are the risks, doctor? And the doctor says, well, if the head isn't super low and applied on the cervix and there's an umbilical cord around there, there's a risk for cord prolapse. Where the cord slips down, it would be an emergency C-section. The risk is super duper low, and I'm feeling for that to know if it feels safe or not before breaking your water. The other risk is, and this is not one that doctors would even necessarily know about, but that it could potentially, if the baby's not high or their chin isn't tucked, it may create a little bit of a misalignment in the pelvis of the baby coming down if the baby's not super low. And then once the water bag's broken, then there's an increased risk for infection because there's no longer a barrier between the cervix and where the amniotic fluid is. So we'd be watching for that, but that's also why I've waited until you're 6-7 centimeters in order to even bring it up as a suggestion. Ideally, in that scenario, they'd go, how does that make you feel? And you'd go, well, I learned all about it, and I'm really opposed to anything that would interrupt the labor process. Like, I totally believe that we need to let the body do whatever it does. I don't care how long it takes. I'm willing to wait as long as baby's okay. Is baby okay? Yep, baby's great. Then I don't feel comfortable with that. Do I have any other options? And now, mind you, side note, that may not be how you feel about it. You may be the patient that's like, oh, speed it up. Yeah, like, hello, let's get this show on the road. Great. Like that's where you and your own preferences, you're gonna have to think about what's important to you. So either or situation, I'm just giving 2 examples and kind of playing devil's advocate. And then you go, what are my other options? And the doctor goes, well, we can wait. We can just keep hands off, and then guess what? Your conversation continues and it goes, well, doctor, what are the risks of waiting? What are the benefits of waiting? See how this kind of goes? And then they go, any other options? And you go, well, I could start some Pitocin. Okay, what are the risks? What are the benefits? What are my other options? Until you've exhausted that list. So now instead of, hey, I'm gonna break your water. Okay, doctor, sure. And you're like looking back on your scenario and going, man, what if I would have waited or something were to happen and a cord prolapse happens and you end up in an emergency C-section? You're going, well, no one told me that. You are entitled to that information, and really it's the provider's job to give you all of those risks, benefits, and alternatives until you can take a step back and go, okay, I'm seeing it all now, and I'm saying I don't want Pitocin, or yeah, actually I'd prefer Pitocin. I'd like to wait and let my body do it, or nah, I don't care about waiting. My water has to break anyway. That's like, it's pretty natural, right? Cool. Or go for it, get this show on the road, make it happen, I'm over it, moving on, let's have a baby, right? Now you can make an informed decision, and that is autonomy over your body, autonomy over your decisions. Along with autonomy over your body also includes, and this is a whole nother video, let me know if you want it, on autonomy on who touches you and how they touch you. That really we should be asking for permission before placing our hands on you, especially performing a vaginal exam, especially inserting anything in the vagina, etc. Okay, so you should be able to choose who does that. Okay, so that's like a whole nother can of worms. Not going in there for now. You have autonomy over your body and over your choices, and that's sort of what the conversation could look like when you're advocating for yourself, because you will need to advocate for yourself. And if you're not able to, this is where a partner comes in, and training your partner, having them take your childbirth classes with you, having them take a coping with labor class with you to prep them to be that person. I always say to my prenatal clients when I'm meeting with them, prepping them for birth, that the partner's job is to kind of create this bubble of peace around the laboring person. And so and part of that is advocacy and saying, I'm going to take this off the laboring person and go, hey, doctor, talk to me about the risk benefits alternatives, and helping to facilitate that conversation. This is also where a nurse could jump in, and you can ask your nurse, hey, this is really important to me. Could you help me advocate for my preferences? Or this is where you hire a doula or a birth coach to help you navigate those conversations. So you're not alone in it. You have help, and you have rights over your body, over your choices. You have full control over your labor. Ideally, making decisions that are confident decisions, that are fully informed decisions, and not decisions out of fear or lack of information or being coerced. Thank you guys for being with me here today and for listening. I feel like a lot of times, and I have some other fun things coming, but this kind of information, I feel like sets you up with being able to do the positions you want, or asking about pushing a different way, or navigating the hospital system, which can feel scary and overwhelming for some, but I assure you it doesn't always have to be, okay? And so advocate for yourself, know your rights, check out the link down below. And if there's any of those that you look at and you're like, yo, can you talk about this one? Because I don't know necessarily what this means, or how would you navigate this? I am so happy to. This stuff makes me so excited because it's how I build confidence in you to have the happiest birthday of your life. So if you want more from me, you can head on over to bundlebirth.com. I have childbirth classes over there, like I mentioned, coping with labor, infant safety CPR. You can work one-on-one with me. If you've maybe had a birth story that didn't go this way that I described, or now you're listening to this and you're like, oh my gosh, that didn't happen, and now I'm having some feels about it, I do one-on-one calls and just listen and offer perspective and chat with you, get to know you, and help you kind of process those memories together. And then make sure you subscribe down below, and then go on over to Instagram and follow me on Instagram, because I am providing other information over there on labor, birth, postpartum, breastfeeding, all the fun things. Stay up to date with me. And then until next time, don't forget to flex and flow, and I will see you soon. Bye. Yay. Okay, hold on, I need to go back. I'm getting on a tangent and I sort of want to pull it in. I have serious roles of the world. What is happening? Oh, that's so annoying. Meaning perform, break my water. Cut that out.